Discover the natural powers of St. John's wort, an ancient herb that has stood the test of time in traditional and modern medicinal practices. Known scientifically as Hypericum perforatum, this plant is celebrated for its potent effects on mental health, particularly in treating depression and anxiety. Beyond its psychological benefits, St. John's wort also offers relief for physical ailments, from menopausal symptoms to wound healing. This guide delves into the fascinating science behind its healing properties, exploring how it influences neurotransmitters and hormones to improve well-being. St. John's wort is particularly noted for its efficacy in treating mild to moderate depression. The active compounds hypericin and hyperforin are thought to be responsible for its antidepressant effects. Hyperforin in particular is a potent inhibitor of the reuptake of several neurotransmitters, including serotonin, dopamine, and norepinephrine, enhancing their levels in the synaptic cleft. This action is similar to that of many conventional antidepressants, such as SSRIs and SNRIs. Clinical studies, including randomized controlled trials, have shown that St. John's wort can significantly improve mood, with efficacy comparable to that of standard antidepressants like fluoxetine and sertraline. Importantly, it tends to produce fewer side effects, such as sexual dysfunction or weight gain, which are commonly associated with pharmaceutical antidepressants. The anxiolytic properties of St. John's wort may be due to its impact on neurotransmitter systems involved in regulating mood and anxiety. Besides modulating serotonin, dopamine, and norepinephrine, St. John's wort affects the GABAergic system, which is directly involved in anxiety regulation. GABA is the main inhibitory neurotransmitter in the brain, and enhancing its activity has a calming effect, reducing anxiety. Several animal studies have shown that extracts of St. John's wort can increase GABA receptor activity, leading to decreased anxiety-like behaviors. Clinical trials in humans are less prevalent, but preliminary studies suggest positive effects in reducing symptoms of generalized anxiety disorder. For menopausal symptoms, the benefits of St. John's wort are likely multifaceted, involving its phytoestrogenic properties and neurotransmitter modulating effects. Phytoestrogens are plant-derived compounds that can mimic the effects of estrogens, which decrease during menopause. By modulating these hormone levels, St. John's wort can help stabilize mood and reduce other symptoms such as irritability and hot flashes. Clinical trials have specifically noted improvements in the psychological well-being of menopausal women taking St. John's wort, with significant reductions in the frequency and intensity of hot flashes. In the case of PMS, the benefits of St. John's wort are primarily attributed to its effects on neurotransmitter systems that influence mood and pain perception. By increasing the availability of serotonin, the herb may help regulate mood swings and alleviate other symptoms such as tension, irritability, and depression that often occur during the premenstrual phase. Several studies have documented these effects, with women experiencing fewer and less severe PMS symptoms after treatment with St. John's wort. Although the evidence for St. John's wort in treating OCD is more limited, the rationale for its use comes from its serotonin modulating effects. OCD is traditionally treated with SSRIs, which increase serotonin levels in the brain. By a similar mechanism, St. John's wort may provide some benefit in managing OCD symptoms. Early studies have shown modest improvements, but further research is needed to establish effective dosing and long-term outcomes. St. John's wort's topical application for wound healing is supported by its anti-inflammatory and antimicrobial properties. The compound hyperforin, in particular, has been shown to reduce inflammatory responses in tissue, which is crucial for the early stages of wound healing. Additionally, hypericin has demonstrated antibacterial activity, which helps prevent wound infection. Studies have shown that topical application of St. John's wort extracts can accelerate the healing process in wounds and burns by promoting tissue regeneration and reducing inflammation. The potential benefit of St. John's wort in treating somatic symptom disorder involves its anti-inflammatory and analgesic properties, as well as its effects on neurotransmitters involved in pain perception. The exact mechanisms are not fully understood, but it is believed that the modulation of serotonin and other neurotransmitters may help alleviate chronic pain symptoms that are often psychosomatic in nature. For SAD, St. John's wort's ability to modulate serotonin levels may be particularly beneficial. SAD is linked to reduced sunlight exposure, which can disrupt serotonin synthesis. By enhancing serotonin levels, St. John's wort may help counteract the mood declines associated with shorter daylight hours in winter. Clinical studies have found that it can improve mood in individuals with SAD, offering a potential alternative or supplement to light therapy, which is a common treatment for SAD. As we've explored, St. John's wort is a multifaceted herb with a range of applications that extend from enhancing mental health to promoting physical recovery. Its ability to naturally modulate neurotransmitters and mimic hormonal activity makes it a valuable tool in the natural medicine cabinet. However, its interactions with medications highlight the need for careful usage and consultation with healthcare providers. Embracing St. John's wort can lead to significant health benefits when used responsibly, offering a bridge between nature and holistic well-being. Thank you for watching. If you found this video informative, please give us a like and consider subscribing to our channel for more insightful content like this.